Cognitive behavioral therapy, known as CBT, is a type of treatment that's been demonstrated to be effective for a wide range of presenting concerns. This includes anxiety disorders, mood disorders, depression, as well as behavioral concerns across the lifespan. Research study after research study has shown that CBT leads to significant improvement in functioning and one's quality of life. It's been established as an effective intervention option as a standalone treatment, as a treatment in conjunction or combination with medication management if needed. And for some presenting concerns, it's even been found to be more effective than medication alone. So in CBT, it focuses on exploring the relationships between thoughts, feelings, and behaviors. It also takes into account the understanding of those contextual or environmental factors that might be contributing to a child's difficulties. CBT utilizes the most effective cognitive, which are those thinking strategies, and then behavioral, which are those action interventions, to target the maladaptive patterns that might be maintaining those mood or anxiety symptoms. This might include things like learning to identify the sneaky ways that our brain can trick us, or also recognizing and shaping those unhelpful patterns of behavior that aren't serving our children well and accidentally reinforcing that cycle. One thing to note is that a specific type of CBT called exposure and response prevention, or ERP, is the most critical component for effective therapy and treatment for anxiety disorders, as well as obsessive compulsive disorder. So this usually involves strategically and intentionally facing our fears and resisting that urge to engage in anxious behaviors or avoidance. So through things like a specialized, specific, and developmentally appropriate treatment plan, we work collaboratively between the patient and the parents to help our children feel empowered to face their fears or tackle their mood or behavioral challenges in order to develop more effective ways of coping. There's several important components that you can expect to see when engaging in CBT. So first, CBT is structured and it's goal-oriented. Typically, treatment begins with a good, thorough clinical assessment with parents and then also directly with the child. And then you'll work collaboratively to have a mutual understanding of those current concerns. You'll prioritize goals. You'll receive evidence-based treatment recommendations on the most effective next steps in your child's care. And throughout treatment, the patient, the clinician, and the parents, you can expect to check in on progress, discuss and tackle any barriers that might be getting in the way, the roadblocks to treatment. They might collaborate with outside professionals as needed, other people serving your child, and then certainly celebrate those successes, those small and large successes along the way. CBT is skills-based. We work with our patients, even the youngest of patients, to build a nice toolbox of unique cognitive and behavioral coping strategies that can also further develop into lifelong skills. CBT is also practical and it's hands-on. So in CBT, we practice, practice, practice. The heart of CBT is action-oriented and it's practical. We not only talk with our patients about what to do, but we do it together. And so whether we're actively problem solving or facing fears directly together, we coach our patients and their parents to apply those skills to reteach our brains and result in meaningful change. There's several ways that you can support CBT treatment at home. So practice between sessions is really so important in CBT treatment. So even though it can be really hard to imagine yet another thing put on your to-do list, it is really necessary, not only for the progress in treatment, but also for the generalization and maintenance of skills outside of our offices. So that might mean things like supporting your child through a brave practice, or it might mean helping to structure some of these tasks that are harder for them, or maybe even implementing a plan yourself as a parent to help shape your child's behavior. Take-home tasks are often set collaboratively between a parent, the patient, and the psychologist in order for the patient to gain those mastery over their new set of skills. So it's great and it's fantastic to see progress in our appointments, but the gold really lies in the progress made in one's own life. So at times, like the best parent practices in helping your child, like for example, facing fears, might be so counterintuitive and so against our parent hat and our intuition. We want to help our child have less distress And it can be really difficult to see our child have even more distress, even if they're in treatment and doing all the things that the therapist is saying. And so a well-rounded and effective CBT treatment plan will often include the parents in the process so that they also feel armed with the tools to effectively respond to their child's anxiety or their mood or those behavioral difficulties. And help the parent also tolerate their child's distress, which is a really tricky but important part of CBT. So CBT is truly a team effort, and working on the same team together really is that glue that keeps treatment going, especially when facing those difficult challenges.